Good evening, everybody. Welcome to this evening's meeting of the Healthy Living and Social Care Scrutiny Committee. May I remind everyone present that the meeting is being live streamed as well as recorded via the internet, and this recording archived for future viewing. Please could all participants mute themselves when not speaking in order to avoid any background noise or feedback when other participants are speaking. If a participant wishes to speak, they can use the raise hand function, or they're able to raise their hand on screen to flag the attention of myself as a Democratic Services Officer or the Chairman this evening, Councillor Janice Charles. Please make sure that all debate is raised verbally and not via the chat function for the sake of the recording, and the chat function may be used to highlight any technical issues to myself or to your Chair this evening. If any participant has difficulty hearing or being heard when they are addressing the committee, then please could they turn their webcam off in the first instance, as this will help with broadband or Wi-Fi width, so at least you can be heard and raise the flag with the Democratic Services Officer or the Chair. Thank you, Chair. That concludes the housekeeping.
Thank you, Amy. Good afternoon, everybody, and welcome. The agenda before you today is finance and performance monetary based. So we'll start off with agenda item 1. Do we have any apologies for absence?
None received via myself, Chair.
Anybody off the floor got any apologies for anybody? No, we'll move on then. Thank you very much. To agenda item 2, which are the minutes of the meeting held on the 7th of June 2022. Would you like me to go through it page by page, or would somebody like to move it on block?
Move it on block, please, Chair.
Thank you, Neil. Thank you, Helen. Moving on to agenda item 3, which is to receive declarations of interest, including whipping declarations. Do we have any? Helen?
Hi, can I declare under item 7, please? It's in relation to the Director's report. I manage services for Newlands, tenancy support services. So if there are any discussions, I will leave the meeting.
Thank you, Helen. Julie, Councillor Julie Lynch-Wilson. Sorry, we haven't met before.
That's fine. I married it.
You've muted yourself, Julie.
I don't think it comes in the minutes as I was in the agenda as I read it, but I work in a private care home, so just in case there's something that comes up.
Thank you very much. Anybody else? No? Well, we'll move on then to agenda item 4, which is the annual corporate safeguarding report for 2021 to 2022. This is an annual and biannual report from Lance for our consideration. Thank you, Lance.
Thank you, Chair. I'm hoping my colleague Natasha James will introduce it as our local authority designated safeguarding officer, but I can't see her on the screen, so I'm hoping that's okay. Are you there, Natasha?
Yeah, I'm here. Yeah. Thanks, Lance. Okay, so this is the annual corporate safeguarding report, and as is just outlined by the chair, it's an annual report with an overview from each directorate in relation to safeguarding activity. So you'll note the cabinet report, and then within that you will note the appendices that's been attached. So I'm going to take us through the social services section of the annual report, and the other sections go to the other directorates, and they will talk through those. This report outlines activities in relation to child protection, so that's child protection conferences and registration. It looks at adult safeguarding, some data around that. It looks at allegations against practitioners and gives an overview of the annual plan of the Cardiff and Vale Regional Safeguarding Board. So taking that through in relation to child protection conferences, you'll note that the first section looks at the number of initial conferences that have happened within 21-22. Previously, in previous year, I think we'd seen quite a significant increase in numbers of children who were subject to child protection planning, and in relation to conferences. I think what we demonstrate through this year's data and activity is that that's levelled off somewhat, and are probably at numbers that we would expect to see within the Vale of Glamorgan. I give some background as to what conferences are, how they take place. In relation to our operating model in response to the pandemic, these were conferences that took place face to face in a room, and actually now that the majority of those, if not all, are on a virtual basis. We do take into account if particular scenarios need face to face, and we've got the ability to have a hybrid approach to that, but at the moment the majority of those conferences are being done virtually. That's had some added benefits in that what we found is there's greater participation of parents and children within those conferences, which were less so when actually we were having them in an office, and they were quite formal meetings. So that's an intended benefit, I think, of having these conferences on a virtual basis. I've given some detail in relation to categories of abuse and the types of areas that we register under, so that being physical, emotional, sexual, financial abuse and neglect, and there can be a combination of those categories. I'm going to move us on into the adult safeguarding section of the report. So you'll note under paragraph 16 that there's been a significant increase in the number of adult safeguarding reports we've had. So this year was 816 reports. So that's, if my math is good, 214, an increase of 214 reports this year. Now, I think that's a number of things have happened. At the beginning of the pandemic, we did have a new set of procedures, and I've talked about this in other forums, but what that did was highlight the equal footing of adult safeguarding and introduced the duty to report, and gave people awareness and understanding of that. So I think that's one of the reasons that have contributed to the increase in reports. And one of the other things I think is this year, particularly relaxation of rules, relaxation of isolation of people. That's also attributed to some of that increase that we've been seeing. When we look at the types of abuse that's been reported in relation to adults, there's a pie chart here that talks through the emotional, psychological, financial, material neglect related to pressure damage, physical, sexual and self-neglect. So that's just to give you a sense of the types of abuse and neglect that is being reported. And I also give some information in relation to the types of locations that abuse takes place, because it doesn't always take place in someone's own home, although that is the predominant location. They can happen in hospitals, nursing homes, community, and we did have one of online abuse this year. So I do note here, just in as much as looking at cost of living crisis and how potentially that could impact over the next 12 months, and that's kind of a theme and trend that we'll be looking at in relation to how that's impacting on adults at risk within our communities. The next section looks at safeguarding allegations against professionals and those in positions of trust. So to give some context, this is about those people who work with adults or children at risk, either directly as practitioners or volunteers, and are in a regulated activity. So we could be care home workers, doctors, police officers, social workers. There will be allegations made against these individuals, and those come into the local authority, and we monitor those and we respond to those under Section 5 of the Wales Safeguarding Procedures. So I've given some context as to the kind of criteria that we consider. I've documented here how many reports that we had through Section 5 this year, and they were 85, and they were practitioners working with children and adults at risk. Some in some scenarios, they can be working across the age range, so won't be one particular workforce. But I document here predominantly 55 are working with children and 30 of those individuals would have been working with adults at risk. There's a bit of an overview there then for you in relation to the professions of those individuals. So the next part of the report just looks at some of those safeguarding arrangements and activity in relation to domestic abuse and our MAREC systems and processes, and then in relation to our MAPA and public protection functions. So in relation to our regional safeguarding board participation, we are represented on the safeguarding board, and we contribute to all of its annual plans and priorities for 22-23, and I've included a link to that if people want to see what priorities are in place for safeguarding for this year. So that takes us to the end of the social services part of the corporate safeguarding group report, and I would open up if there are any particular questions in relation to that.
Thank you very much, Natasha. The recommendation is for noting and consideration, but does anybody have any questions they'd like to ask? No.
Susan Lloyd-Selby's got a hand up, Chair.
Oh, I can't see Susan on my screen. I have to shout out Susan.
Thank you, Natasha, for taking us through that. That's really helpful. So in last month's committee meeting, we were hearing about the number of people in the Vale who'd been assessed as needing care and support, but whose needs were currently not being met because of the challenges around finding carers to support them. So my question is, what steps is the council taking to consider the safeguarding needs of those adults who've been assessed as needing support but are not currently in receipt of it? Yeah, Lance, I'm guessing
did you want to answer that question?
I think it's probably a bit broader than Natasha's role, because obviously Natasha's looking at it very much from the safeguarding aspect. And much as I had my hand in the air, I was actually thinking of Suzanne when I was putting it up. So I'm sorry to do a bit of a pass to her. But the waiting list that we have for people who are requiring domiciliary care is regularly reviewed, and each of those individuals are risk assessed and prioritised in terms of that care. I don't know, Suzanne, whether you're able to put any more detail on that for the council.
I have to apologise, Councillor Lloyd-Selby, but my reception cut out, so I only caught part of the query. Would you mind repeating it? I'm so sorry.
No, not at all. So my question was about those adults who've been assessed as requiring care and support, but where we're not able to currently provide that because of the lack of carers. And I was asking how any safeguarding issues are identified and responded to. So Lance has helpfully already clarified that part of the initial assessment process is that there would be a risk assessment. So it's what further steps they might be taking to ensure any safeguarding issues are picked up while they're waiting for their care package to be put in place.
Absolutely, and so to build further into that response, so when that initial assessment is conducted, they will be given what we call a risk rating, and that will allow us to ensure that we've made the right inquiry. So if there was immediate flags around safeguarding, we would involve the safeguarding team. Meanwhile, we will retain a dialogue with the individual themselves and or their referrer to ensure that we're very aware of any escalation in regards to their needs. That then means that we need to reflect again that risk assessment to see, is there a deterioration in the position? Are they at further risk because there's been a delay in trying to secure that care and support? So we have that ongoing dialogue. Some individuals will be identified as needing to have a constant check-in and what we refer to as a wellbeing check, and will be part of either a social care officer's caseload or a social worker's caseload. And so we don't abandon an individual whilst they're waiting for that care and support. the knock-on effect of that is, of course, that because individuals stay with our intake and assessment team during that time whilst they're waiting to secure those packages of care, then that has the knock-on effect in terms of the waits that people have for some further assessments, and so in that domino effect does occur. But to ensure you that, you know, as I say, there is that ongoing dialogue, and we ensure that we also make sure that contact details are given, so that, again, if the position changes and the individual is able to identify that themselves, that they can obviously keep in touch with us. So there is that constant review of risk, that dynamic risk assessment, and it's certainly individuals who are waiting for packages of care. We have had to date a weekly meeting where we make sure that we are very aware of the individuals that are waiting for those packages and reprioritising them depending on those circumstances.
Do you want to come back, Sue?
Just to say thank you. That's really helpful and reassuring. Thank you, Suzanne.
Thank you.
Yeah, very reassuring. Thank you. Anybody else like to ask a question? Neil?
Yes, please, Chair. This is for Natasha. The figures you give us for complaints against various groups and various people are interesting, but there's no indication of how many of those turn out to be without foundation for investigation and so on. I mean, are all the figures that you've given us ones that have been taken to investigation? There are others that we're not being told about. I mean, for example, the 85 concerns re practitioners that you gave us, of those 10 have gone are being investigated by police, but we're not seeing what the other outcomes are, whether any of those were meritless or found not to be what they were represented as being, perhaps is a better way of phrasing it. Can you give us some enlightenment on that, please?
Yeah, of course I can. And it's always a balance of how much information to give and how much. And because we do document, we work to, there are 5 determinations of the process. And I think I've given some indication of, although a number were reported, some didn't go through the process because they didn't meet the criteria. But what we do for each and every case is that there is an outcome. So there is a range of outcomes which will be unsubstantiated, substantiated, unfounded, malicious. So we collect data on those. And I can't tell you off the top of my head today what the figures were, but I can include that for future reports if that's of interest to you. Because I think, as you rightly point out, it would be, what I can tell you is there are not a huge number that are malicious or unfounded. There's a very, very small number, but we do have a number where they're unsubstantiated, and there's a very clear definition of what unsubstantiated means in this process, and it means that there is an evidence to either support or not support the allegation. So it's a bit of a catch-all sometimes, and I would say that's the predominant outcome that's used. However, there will be situations where there's also a criminal investigation and we're waiting for criminal investigation outcomes. So we can't determine the original allegation until that's concluded. But I will definitely include that in future reports for you.
Yeah, it would be helpful because I mean, the bold figure of 800 and whatever it is that we got right at the start of this is a big figure, and it's quite scary in some ways. Yes. But if you boil it down into those which are, I mean, sometimes a complaint is made, a report is made because someone's misunderstood the process and has felt aggrieved about a particular part of the process, but they make a complaint, and that has to be recorded because that's in the nature of the thing. We do have to record all complaints, and that's right. But the complaint is actually not what they think they're complaining about. Do you follow what I'm saying?
Yeah, and just for clarity, the figure of 800, and I think it was 816, is in relation to reports about individual adults at risk. So they were about individuals who people felt were adults at risk and needed an adult safeguarding response. The figure of 85 is in relation to professionals, practitioners, and those in positions of trust. So,
sorry, yeah, I am conflating the two, and I shouldn't be. Yeah. You're right.
Of the 800 you know, we made inquiries on a number of those cases, and again, you know, they would have resulted in a number of things. Either that individual didn't require care, support and protection, that individual may have required ongoing care, support and protection plans. So a lot of activity happens, and I think I'm probably giving you a snapshot of figures and data to give you a sense of the activity and the overview. But yes.
I mean, I do think it would be helpful to know things like that within the paper, because, as I say, you get these bold numbers, and without sort of drilling into them and finding out what they actually mean in fact, then you know, you go away and say, right, the 816 reports have been made about adults or whatever being concerns about these people. But then, as I say, or as you've just said, a number of those, but we don't know what the number is, aren't necessarily what people think they're doing. And then of the 85 concerns, I mean, certainly against professionals, again, some of those you said a very small number were malicious complaints. Others were without. Well, the five categories break it down, but then there are 10. I mean, we certainly know some in education where things are being taken to court. I mean, that's happening, and those figures will be in there somewhere. That sort of spectrum of things, from the really serious things that we know about that's going to court later this year, to perhaps things that are not included. Do you know? Am I making sense?
I suppose, yeah. In answer to your question, but I suppose the premise is that all of these that will be responded to are rightly reported, and they are responded to because they have to be responded to. When we're talking about the allegations in the Section 5, in relation to the 816 adults at risk, we did 597 126 inquiries, so they went on to further inquiries. The difference in those figures may have been signposted to support. They may not have been identified as being adults at risk under the definition. It may have been a whole range of things. So yes, if you'd like some context of some of that data, I will do that for future reports for you.
Yeah, for me, yes, please. Yes.
Thank you, Natasha.
No problem.
Appreciate your responses very much. Thank you. Does anybody else have anything else to ask? No. And the recommendation was noted in consideration. We all happy with that? Thank you. Moving on to agenda item 5 and 6, which are the reports of the Director of Social Services, but 5 and 6 will be about finance. Gemma Jones is going to take us through that. You may find that the same thing in 5 as in 6. This has never been done before in the way it's been done today. It is a trial, so let's see how it goes. Thank you, Gemma.
Hello, good evening. Thank you for having me. So firstly, I'm picking up the revenue monitoring to the end of May 2022. So as the chair set out, what we have in the report is an overall summary of the council. So my intention was to pick up some of those kind of headline issues that we're encountering as an overall authority, and then pick out some of the specific issues affecting the remit of your committee. So in terms of the revenue position for the financial year, I think we're encountering kind of issues that you've probably seen in the headlines and probably from your own professional lives. So the kind of high level inflation, the cost of living issues in terms of the salary costs. In terms of energy, whilst we had bought the majority of our energy in advance for 22-23, we are seeing an increase in standing charges. So I think we've got a cost pressure in year of around 300,000 across the council. So certainly not as large as the cost pressures we're projecting forward into future years, but certainly a cost pressure that needs to be absorbed in year. Pay negotiations are ongoing in year, so we have an estimate for pay built in, but that will need to be reviewed as we progress through the financial year. I pick up in the report some of the funding. So there are some small elements of COVID funding that are ongoing into this financial year. So we're receiving some funding for free school meals, for instance. There's statutory sickness protection in the social care sector, and that's actually recently been extended. And also some self-isolation payments that they will be finishing shortly. So just to pick those up. And we've also set efficiency targets for the financial year. So drilling down now into the some of the service specific issues. So if we look at social services first, there's environment included in this report that sets out the reallocation of those savings targets, because social services has indicated where it expects to find those efficiencies, and that's illustrated in the appendix to the report. But we're also requesting environment to reflect the use of the reserve as part of the budget programme that was agreed as part of the final proposals in March. So this programme utilises 1.437 million of reserves in this financial year, and that use of reserves then would be slowly stepped down over a 5-year period. Now, probably the piece of the puzzle that's missing from the report, and I apologise, I'll make sure that's included for future reports, is that the balance of that reserve at the start of this financial year was 10.7 million. So there is adequate provision in order to use this reserve as part of the proposals, and also maintain a significant buffer to be utilised in this very volatile service area. In terms of social services, we are reporting an overspend in the children's services area, and there are a number of reasons behind that. So we've got some pressures around legal costs because of the very complex court cases we're encountering, support for special guardianship and residence orders, when I'm ready placements, and also increased costs for the intake and family support team in terms of transport and accommodation. That this is offset by favourable variances within the service, and it's expected that that overspend can be funded from social services reserves as well in year. But obviously these pressures will need to go forward into cost pressures and be reflected into our budget proposals going forward. In terms of adult services, we're currently working through the costs of placements and the various grant funding that's available, and also for resource management resources, and we'll be bringing a more accurate projection as we progress through the year, but at the moment we're projecting a break-even position. Leisure services is also reporting an overspend, and this is due to the leisure contract. So I think in terms of income, it hasn't picked up post-COVID as much as to pre-pandemic levels, and whilst we have been receiving the loss of income grant funding from Welsh Government up until the end of last financial year, this cost is obviously now need to be picked up to a certain extent by the council, and it's expected again that that can be offset from the council's neighbourhood services reserves. So those were the key elements of the report that I was going to pick up, but I am happy to take any questions, and I will do my best to answer them or take them away.
Yeah, the recommendation is to consider the content of the report. Does anybody have any questions? No, thank you. Can we move on to the next agenda item 6, which is the capital monitoring for the period of the 1st of April till the 31st of May 2022.
Okay, thank you very much. So in terms of capital, again, as you'll be aware, we are encountering significant increases in construction costs and shortage of materials and quite long lead times. And there's also a shortage of professional services in some areas. And so what we're seeing is a number of schemes are having to go back out to re-tender. They're needing to be allocated additional funding or to be redesigned. There aren't actually any changes in this report that are significant to this committee, but there are a number of schemes in the appendix that I just wanted to quickly touch on. So, for instance, within the social services remit, there's there's some funding for asset renewal that's set out in the report, and those schemes are starting to be implemented. But there is a scheme, an ICF scheme for Carers Close refurbishment project, and that was a scheme that was subject to not having sufficient funding to progress because the cost of the original tender came back quite high, and so that additional funding has been identified from reserves to progress that scheme, and that's been approved via an emergency powers. And then in terms of leisure, we have some schemes relating to the Penarth Leisure Centre high level glazing, and so this is a relatively significant scheme for the area. It's 1.695 million in this financial year, and again this scheme has been brought in via emergency powers. It is a bit of a issue for health and safety, so it's important that we get this scheme progressed. And we'll be utilising some funding from reserve, and external consultants are being appointed imminently in order to progress that scheme as soon as possible. Happy to take any questions on this report.
This report was to actually note that the capital programme for schemes in this particular remit. That's the recommendation. Neil?
Yeah, thank you, Chair. Yeah, it's not questions so much as an observation on the report. I mean, you and I, Chair, will have seen various reports in the past, and they have been less clear than this, to say the least. This is a step up. It is a far more clear report than what we've seen in the past. And I'd like to thank Gemma for this and for taking on board some of our criticisms that we've made in the past. I don't know if she was aware of them, but certainly to see the reports presented in this way, I think, has made our job a lot easier. The fact that we've not got any questions particularly about it, I think, indicates the quality of the report. Thank you.
Thank you, Neil. I was going to thank you myself because I think it is a much clearer report. And are we all happy then to note the progress made in 2020 to 2022 and 23? Yep, thank you. Then we move on to agenda item 7, which is the annual report of the Director of Social Services 21-22. It's a challenge version, and as this report comes in once a year, and we haven't, as new councillors, you haven't been through this before, I think Lance is going to be a bit more concise in going through it for us. Is that right, Lance?
I will try and be as concise as I can. I think the older committee members will know that we took out some reports, such as those on complaints and compliments and on consultation, because they are consumed within the body of this report. So I feel like I've got to draw your attention to those bits as I go through in order to make sure that they get proper scrutiny.
I think it'd be good for the new councillors for you to do that, Lance. Thank you.
Thank you. So I will get into the actual report in a moment, but the scrutiny report that is operating as a covering report does explain that the director's report is a requirement set by Welsh Government. They are very prescriptive about what has to be included within it. I think the report that we've attached is now part of a SWAY document. It's much more accessible, so I think we've probably taken that as far as we possibly can in terms of making it accessible, given those requirements from Welsh Government. The challenge version comes to Scrutiny Committee and also goes out to a variety of partners over the summer, so that I have the opportunity to make any changes based on any feedback that I might receive. And so I'm really open to receiving feedback, and if there's bits that you think we should expand on, cut down, whatever, or add in, then I would want you to say and do that. you'll be familiar from our conversations at previous meetings and through, I think, the member induction process that social services is experiencing highest levels of challenges that I've ever experienced in my working career. And I think the director's report is put forward in that context, albeit for last year. So it's an appraisal, if you like, of our performance last year, but it is in that very difficult set of circumstances. The staff in social services bowl me over every day in terms of the commitment to the work, the commitment to their service users, and so the report doesn't come across as, or I hope it doesn't come across as, I probably should say, as desperate as I think we probably know the situation is at the moment. It needs to recognise, I think, those contributions that they've all made, the huge amount of efforts that they've gone to keep the show on the road and to keep people looked after. And so I think what it does, and I think something that we've continued to build on through the use of photos, through the use of videos and so on, is it hopefully brings some of that a bit more alive than it would in a traditional Word document, I suppose. So there is the appendix to the report a feedback form. I'm not expecting you guys to have to use that. If there's anything that you wanted to say, either say it now or drop me a line. As long as that's over the next month or two, that would be perfect. So it will go to Cabinet hopefully in September, and so I will need to start preparing that report in August. So to actually get to the director's report, the annual report itself, as I said, it is for last year, and already things feel like they've moved on a lot since March and April. We are still very much reeling from the pandemic. It's not over for us. Staff continue to be affected by COVID. I'm quite alarmed about the number of people currently off, albeit fortunately for reduced periods than it was during the actual height of the pandemic. So I think, in terms of our performance, so that first section of the report, I've tried to pull out some of the highlights, tried to show you how many people we have, helped give reablement packages for despite those challenges. Also, I think one of the areas that we've improved significantly is the number of people that we've been able to offer assessment services for in Welsh language. And I think, that said, I would recognise that there are a number of areas where we need to improve still, and we're still looking at how we can improve the timeliness of some of our assessments and the experience in terms of multiple placements for children over the year. Hopefully the picture that you would have picked up from the previous meetings and those inductions will give you some of the explanation as to why we're in that position currently. I think there are some hopefully helpful infographics, and I think the impact of the pandemic and the work that we then had to do that was quite different to the stuff that we've done before, such as supporting immunisation, supporting testing. That's nothing that social services ever previously did, delivering PPE. And I think, you probably hear about that and see about that, but when you see the volume, 33 million items distributed, it gives you hopefully an understanding of the scale of the work that involved. And similarly, best part of 300,000 tests for our workers. So the LFDs that you're probably familiar with. If you're not familiar with SWAY, something like we call them a card deck, but those blue ones, if you click on them, you'll see that they move on to the next one, and you'll see some of the comments that we've had, particularly in this report about the PPE team. We've had a lot of the providers who we sorted PPE for throughout the pandemic are extremely grateful, and we wanted to make sure that was recognised within it. as I say, there are challenges, and I think, you know, in the challenges section, it talks very much about those in terms of, you know, the complexity for of referrals for children and young people, the increasing difficulty in terms of finding placements, and yet I suppose, you know, some positives there also in terms of how the Regional Adoption Collaborative has handled and responded to those, you know, increases in demand for post-adoption support. Similarly, in adults, you're familiar, we've talked about it already this evening in terms of safeguarding, but at a previous meeting in terms of, most importantly or most significantly, in terms of domiciliary care and the impact that that's having. And I think Suzanne explained earlier in response to Councillor Lloyd Selby's query how that impacts on other parts of the adult care system. In resource management and safeguarding, which is the area that does all the commissioning and support to the care sector, obviously they've been incredibly busy trying to do all of that work. So again, it's felt across the whole directorate. I think, as I said, one of the reports that you would have previously had in the past would have been about consultation and how we engage with service users, and we run a number of engagements and consultations that are bespoke to the services that we provide. We want to understand whether each of those teams are performing as the users of those services would expect. These are small individually, but collectively, I think they tell quite a positive picture. And I will come on to some of those when we get into the compliments and complaints. But I think what we see significantly through that is how positively our services are welcomed and received by those who receive them. And I think that's consistent across all of them. You know, we've done those consultations essentially across our Vale Community Resource Service, which is the one that does our reablement and rehabilitation. We've done one in the Adult Placement Service, which supports a kind of foster care, I guess, for adults, for those who aren't familiar with that, predominantly for adults with learning disabilities, but not exclusively so. For our day services, which provide activity and meaningful occupations during the day, again, that ranges across the client groups, physical disabilities, learning disabilities, and older people. And the alcohol and drug team, that's another one which the consultation was completed in. Within children's services, it covered the fostering service, adoption service, and for our children looked after, to try and understand their experience and involvement with care planning. Also in children's family, the Flying Start service and the Family's First Advice line, the Child Health and Disability team, and leaving care. And within resource management and safeguarding, it's focused on residential care. So I'd like to think that's a broad range of consultation events. It's a rolling programme, so we continually move it around, so it won't go to the same team the following time unless there's a need to follow something up specifically. In terms of the compliments and complaints, I'm pleased to say that this year I think we've actually finally got a bit better at recognising our compliments. I think I'd often go into teams and I would see things on the walls from service users thanking them, and then I'd come to Scrutiny Committee and I'd say, oh, we've had one compliment in the last year, or a handful, and I knew that wasn't it didn't relate to actually what was really happening, and so I still think we've got a way to go. I still think we get more than are described here, but you will see that we've had 91 compliments, and that's really positive. And you know, there's some speech bubbles within the report that kind of show the kind of comments that we actually get. In the Community Resource Service that is based in Barry Hospital, they have a wall with a notice board on it, and they started putting cards on that. I'm really lucky, or they're really lucky, it's a very long corridor because it's filling up with cards and compliments. But not everybody compliments our service, and I think, you know, we have to also look at the complaints and where things haven't gone entirely right. And so we had 90 inquiries. We deal with complaints in a what can feel a slightly confusing way, and I suppose I'm going to try and to explain it. But we treat an initial complaint really as an inquiry, because quite often actually it's something that just needs to be rectified. It's something that needs to be sorted out. Somebody might phone up and say, "Where's my carer?" for example. They haven't turned up, and that isn't actually a complaint if we can phone the care agency, get this sorted, and it's all resolved instantly. So inquiries that we still count them, because we think they're an important way of making some measurements. Where people actually genuinely want to make a complaint, we try and deal with them at stage 1. And stage 1 is usually dealt with by the team manager of the team where the issue has occurred. Again, close as possible to the front line to try and get the situation rectified as soon as possible, or investigated as soon as possible. And then stage 2 is slightly unusual, because they normally follow stage 1, but they don't necessarily have to. So sometimes we can have a stage 2 come at us from the first instance. So those stage 2 complaints are conducted independently. We have to buy them, so we get somebody in to come and do that piece of work. And then also there are ombudsman complaints. So where people aren't satisfied with any of that, people can go to the ombudsman. Sometimes people go to the ombudsman anyway, because they're cross and annoyed at the beginning that things haven't happened in the way that they would want to. But usually the ombudsman would direct them back to our complaints process first, and expect us to deal with that. You'll see that we have trouble actually meeting our timescales all of the time. They're quite tight, those timescales, particularly around a stage 2 investigation. I think it's 3 or 4 weeks they're expected to take. They often take months. You know, the kind of issues that people are complaining about aren't simple and easy to understand. It's not a question of just looking in the notes and finding the answer. Lots of people would have to be spoken to, interviews conducted, and so on. But the advantage of that process is it's thorough, and you know, the numbers, I suppose, that indicated in that table show actually very few are unsatisfied at that. They may not be satisfied with the issue that has happened, but they are satisfied that their complaint has been investigated properly, and that we have put then in place whatever we've needed to deal with it. The complaints element also covers a number of categories in terms of what sort of complaints they were, and you know, you'll see within that, you know, some variation, and that probably varies according to the type of service. So, you know, I can read the first one off, although it's very, you know, we don't charge for children and young people services at all, so you wouldn't expect there to be anything within that category. So some of it is as to be expected, and you know, within adult services, it's far more likely that care would be arranged, and so you're more likely to see the types of complaints that are about the quality and the level of service, because it's provided by a commissioned service and so on. So I don't think they're particularly surprising in terms of what the complaint is in terms of the type. But I think we've also tried to again set out for you in this report some of the kind of things that we recognise as issues that are lessons learned for us in terms of those complaints, and I suppose typically they could be summarised as communication issues and being clearer in our recording, and how we you know, set clear expectations of what we can and can't do. I think the next part really is probably the meat of the report, and the sort of prescriptive requirements to develop priorities under the well-being standards. So you'll be aware that we have various other self-assessment processes that occur outside of social services. So there's a council self-assessment that we have to do, and the new local government act. I think I have the act name wrong there, but it's a piece of legislation that affects local government. But they set different sets of wellbeing standards than the ones that are in here. So there is a bit of a juggling exercise, but we have tried to make sure that we are as slick as possible within that and don't have multiple different actions and priorities coming out of different schemes. So we have a way of bringing this together behind the scenes. So we set priorities last year, and within the report you'll see what we say that we repeat what the priority was, but we also give a detailed explanation of what we've managed to achieve against that priority. And within that, some of the successes and challenges. So we have one. Priority 1 was about developing more online services and improving responsiveness and assistive technology. And you'll see that I wouldn't say we were there yet, but we have secured some capacity in terms of service development, and we have an action plan in place and are working hard on developing a new platform, and have also introduced a full response service. So there is progress against all of these things, and really positively, but I think each of them have challenges, because we recognise that none of these things are entirely finished as yet. I'm not going to go through all of these priorities because I think I will lose you if I do, but I think I will skip through to the bit where we actually talk about what we will do next year, or further down the report. So hang on a second. Sorry. So the only thing I would draw your attention to, actually, as I'm going through this, is some of the photos that we have put in the report and the videos. They are in here, and they in some cases the videos are really good illustrations of some of the direct work that's happening. The youth offending service, which is run by social services, I think we talk about the reparation project work, and it all sounds like something that happened somewhere else, but when you see the photos of the area in St Athan that was cleared by those young people, you see that will have undoubtedly gone a long way to help how those young people are perceived in that local area, and hopefully they will have learned something through that process as well. Again, there are case studies within the youth offending service bit within Wellbeing Standard 3. And Wellbeing Standard 4, there's some really good videos from the Flying Start team that are really helpful and informative. These haven't been produced for Scrutiny Committee. These are produced for the people that they are working with, and I think they're useful here because you can actually see what we're using. And so I think again with Wellbeing Standard 5, some really good work with foster care, and I think we're fortunate that one of our foster carers received an MBE for her dedication to foster care services in the Vale of Glamorgan. I should probably tell you one of our staff also received BEM, one of the ones who works at the time in our PPE team. So it's good to see our staff recognised for the work that they do, or that we help to enable for them. So as I said, I wouldn't go through all 12, but I think that at the end of the 12, and I know I started with this, but we can't do any of our work without the people who work for us, and they do an incredible job. And given the absolute challenges of the pandemic, the absolute challenges that you're hearing about now in terms of managing people who are waiting, making sure that is as low risk as it possibly can, dealing with higher than usual numbers of referrals, coping with sick colleagues, that's a huge ask, and I'm really proud of the fact that they have all risen to that challenge and continue to do so. I think it was really nice that a group of our staff also came up with an initiative that wasn't just about people in the Vale, it was about people in Ukraine and the difficulties that they're undoubtedly seeing, and was desperate to try and raise some money. And so, although it's not strictly our business, I felt it was worth including within the director's report, because it really shows the way our staff will approach these things. I know we had budget on the agenda this evening, but there's some global numbers here that I think might just be useful for you to have. I'm not going to go over them in detail here, but sometimes it's hard to understand the scale of what we do. A lot of what we do is commissioned, and so you'll see, small numbers of staff dealing with huge amounts of business, quite often in social services. I think in terms of some of the other aspects, I suppose we don't work in isolation. We work very closely with the health board, other partners, police and probation, so on. It's probably quite obvious, but we also have a very I think a strong and respected profile within the organisation, and I don't think that's necessarily always the case in other councils, and I think that's something that we have earned, and I think it's oh, and thank you, Suzanne. I can see you've added another BEM. I knew there was another one. I think there's another one in somewhere else as well, but I'm not entirely sure. Rachel may have them. I may have counted the other person twice. But yeah, it's good to see that we have got more awards. But the other thing, I suppose, the bit that I particularly wanted to draw your attention was our priorities for 22 and 23. These aren't new actions. They are things that we are determined we are going to do anyway, but we are saying that these are the ones that we would prioritise. And I think I would really welcome, in particular, obviously about any parts of the report, but in particular this part, in terms of whether these are the right things. And I appreciate, as new members, still getting to grips with the work of this committee and the work of social services, that may feel difficult. But anything that you can offer to us, I think would be really helpful. And so those priorities at the moment, I have to group them under the standards. It may not be a perfect fit, but that's part of trying to make Welsh Government work. But the Your Choice model and continuing to roll that out, that's our outcome-based domiciliary care model. So that's where service users get much more choice and control over the care that they receive. We want to do that across all the providers. We currently have 5 providers doing it. We want that to be the mainstream, the normal way of doing things. With the strength-based approach, again, as I said, these are things we're still working on, but we think this should continue to be another high priority. This is about making sure that we work co-productively with children and families, focus on what they can do and not on what they can't. I think I've mentioned that we've got some starts in terms of the telecare service, in terms of being able to provide a integrated full service. I know, because I went to one of my neighbours just the other day who had fallen. They had a telecare thing around their badge, and it was much better if we had had this service properly up and running. So it clearly is something we need. The work of the Alliance model. So I think most of you would be familiar with the Vale Alliance, which is our programme for integrating health and social care. And then in terms of wellbeing standard 3, we want to make sure that we embed the escalating concerns process. This may be something that you haven't heard so much about, but this is where we have care providers who are struggling for whatever reason, and there is a dip in the quality of care. And so we have essentially a performance process that at the moment we have been working to an old one, but we are currently engaging with providers around this new one, and the feedback from them at the moment is positive. So we want to embed that and make sure that those processes become as slick as possible. In terms of the Youth Offending Service has an enormous plan, but it has recently, I think I'm allowed to tell people, it's recently been inspected and had a good outcome provisionally. So that's really positive, but we're keen again to make sure that service does even better. I think it's got lots of potential to become a real flagship service, so I'm keen that we support the development of that. I think you will have also probably seen and heard about DEWIS if you were at the member briefings, and DEWIS is our essentially an information portal for all sorts of information about social services and services within the locality. So anything that would be allied, I guess, to social services, third sector services and so on. It contains lots of information about them, broken down to a very local level. So you can put your postcode in and you would find out what was literally hundreds of yards away from you. So again, we need to make sure that that stays up to date and works properly. I think one of the parts that probably builds on the strength-based approach is actually making sure that the paperwork that we have in children and young people's services matches that, and all of our systems are updated with that, and that's accessible and friendly to the children and families that we serve. And then I think, you know, one of the other ones was about in terms of wellbeing standard 5 was implementing the regional strategy for unpaid carers and associated services. I'm sure you will pick up from your work with your constituents that we need to continue to support carers, and anything we can do more to support carers will be hugely beneficial. Similarly, I would hope you may have also picked up that we need more foster carers and want to make sure that we have local foster carers who can support Vale children. So again, that remains a priority for us. And I think lastly was about expanding the development of the Smart House and reviewing the outcomes that we will achieve from that. And I think, you know, Councillor Thomas, I know that's something that has been something that you've been keeping a very close eye on previously. So we're not done yet, and there's more work to do. So that's why that sits in priorities. So I think I have finally finished. I'm sorry that wasn't especially concise, but I do think it was to try and probably build on some of the induction that you've had so far, explain a bit about how the report is constructed, but also to hopefully get a steer from you whether we are heading in the right direction. So thank you. Happy to take any questions.
Yeah, thank you, Lance, for a very detailed report and taking us through it. I'm sure it was extremely helpful to all the new councillors and interesting as well. I think that social services have had more challenges than any other departments, and I'd just like to send, and I'm sure the committee will agree with me as well, our thanks for all your staff for what they're doing, especially as I know that quite a lot of them have gone over and above what they should be doing or had to do. And so, yeah, very much appreciated indeed. Any questions, anybody for Lance? Julie Lynch-Wilson? You're on mute, Julie.
Sorry. I was trying to find the button. It's not a question as such, it's just a few comments. Obviously, working as I do in social care, just the PPE deliveries were fantastic. The pod, we had a pod delivered that the residents could meet their families in. That was inspired. It made such a difference to our residents. It's been a long road, and without the help and support of the council, I don't know where we'd be. We're back wearing masks again because we have positive cases again, so it hasn't finished, but hopefully on the way. But I'd like to give your team, well, I can't tell you how grateful we all are, because we knew we had the support. So thank you all.
Susan?
Yeah, thank you. So it's not often I find myself saying that I really enjoyed reading a report. I love the format of the report. So, you know, congratulations to all concerned around that. I found it really accessible. I thought it was really helpful, particularly in terms of the intention that it should be a challenge report. I would imagine that it would maximise engagement with the report because it's so easy to read and understand. I thought some of the case studies particularly were very powerful and very helpful in terms of seeing the impact of support and services for people in the community, and it really helpful to illustrate the importance of the work that's being done. My only question is that sometimes in terms of statistics around performance, it can be hard to judge whether or not on the face of it that level of performance is something that we should be celebrating or concerned about. So I'm certainly not suggesting that we want comparative data with the previous year for every stat or with other authorities, but if we wanted to find that, so if we wanted to look at a particular stat around performance and get some idea of as to whether or not that performance has improved since the previous year and how that performance might compare to other local authorities or national figures in Wales, where would we find that? Where would we look for that, just to help us understand better how the Vale is performing?
And that's a fantastic question, and you're entirely right. And I think one of the difficulties is that we've had is that there have been a lot of changes to the performance measures, and so we lack some of that consistency and an ability to compare ourselves with Wales as well, because you know whenever you get a new performance indicator, I can guarantee that there's probably 22 different ways of measuring it, and so the comparison doesn't always work very well. That said, we report to Welsh Government on a whole set of performance indicators, and I think it would be right for us to bring those to Scrutiny Committee. I mean, they come in the subsequent report, the next report, so some of them are peppered within those. But I don't know whether I'm talking myself into something I don't want to, but I think there probably is. It probably would be helpful for you to have something that was much clearer in terms of where our performance is and where we would see it, and where we compare well or not so well to the Welsh averages. But at the moment, we're struggling to get those really to bed in. We've also had I feel like I'm getting my excuses in early now, but we've also had performance issues, as have the whole of Wales, with the WICIS, the Wales IT system, and so that has impacted significantly on our ability to report performance in a way that is reliable, and so that has been a real challenge. I think we're through the worst of that. And we are also starting within the Directorate to actually look at how we can get performance measures to work for us, because the ones that we give to Welsh Government aren't always very helpful. They don't really necessarily tell us or potentially you anything that would help or support you either to make that judgment or to actually know how to do something differently. And so we've been looking at how we use modern technology, so Power BI, which is a part of the Microsoft Office 365 suite that we have, how we can use that to actually give practitioners and managers something that's more real and in real time. So we've got one at the moment for the regional commissioning regional commissioning group. That's a dashboard that tells me how many people are waiting for domiciliary care this week versus last week, and so on. That's really helpful for us to concentrate on our position locally, and I think so that's the way forward, I think. But I can understand very much that you would like to see probably all of those figures. Maybe should we wait until after the next report, and then if you feel that the next report doesn't do what you need, then we could look at doing something bespoke in social services for you. Yeah,
I mean, I've looked at the next report as well, and so I absolutely accept the challenges around when the things you've got to measure change. It's really difficult to do those comparisons, and so certainly some of the detail is in the report, and I think it's in this particular challenge report that it would be so useful, certainly not to have it in every area, because I think you can go down a rabbit hole over stats and it's not helpful. But perhaps in the key areas for you and the departments in terms of pressures and opportunities, it's just something that I think might be helpful for helping partners and us as councillors to better understand where the pressures are, but also where the department is performing well. So yeah, certainly the next report is helpful, but it's whether any of that can be translated into this report in terms of accessibility for a wider audience.
Thank you, Susan.
Sorry, thank you. The only thing I would say, I think, is that I think probably what's happened, we did very much do that. It used to say last year it was this and this year it's this, and it became cumbersome. I think what we've probably done is gone too far the other way. So I think that's really helpful. Thank you.
Yeah, thank you for the input, Susan. Helen?
Hi, thank you, Lance. I also think the format and sway is brilliant. It's really accessible. It's very interactive and stuff. My only criticism from my perspective, I'm dyslexic, so I see things slightly different to your average person. So there is no explanation in how we shape our services. When you go through what each service area is, if I'm a layperson reading it, I don't know what they are. So it might say Vale VCRS, but if there was some kind of a link to each thing that tells me what it is, that would have made my life easier and anybody else reading it. So it's kind of, you have to have the knowledge before you read the report. So it would be nice to know what it is. And that is on the Flying Start bit. I noticed there are some links to the Facebook page and things like that. But I think as a standalone thing, maybe an explanation of each service area and what it is, because it does also say about YOS and all the other different things. But what is it? So other than that, for me, absolutely brilliant. I loved it. Thank you.
Thank you. That's really helpful. I will add that in because I think that's a really important point. So thank you very much.
Neil?
Yeah, I mean, on that, on Helen's point, actually, we discussed in the agenda conference, Lance. I think at the end of the agenda conference, the need for a beginner's guide to acronyms. I remember when I first started on the council 5 years ago, going into various scrutiny committee meetings and seeing this alphabet soup presented to me about this, that and the other, thinking, what the hell am I looking at? What is going on here? And taking time to learn that, and the need for new councillors particularly to be presented with an acronym guide would I think, I mean, we discussed this, as I say, the other day. I think you accepted that could be helpful. Yeah, no, the report actually, it's in itself and of itself, the format of this challenge report and the accessibility of most of it, I think, is a credit now. It is, as others have said, and as I'd like to support, it is a pleasure to read some of it. I mean, there are one or two sort of figures that perhaps need looking at. To get down some of the specifics from the report, things like the performance snapshot, we're talking about 10% children look after have had three or more placements in the last 12 months is a matter of, I mean, you'd expect me to pick up on this. It's a matter of huge concern. And I'm sure Rachel's going to hate me for pointing it out. The figures aren't good, and that is an area that's you talk about improvement areas in relation to that, and I'm just asking for some flesh on those bones as well, please. You know, how are you going to improve? Thank you.
I'm wondering if Rachel's going to come in.
I mean, I can do. It's I mean, our placement stability figure has been very good in comparison with other local authorities, and we saw an even greater level of stability during the last 2 years. And foster carers really kind of pulling out all the stops really to maintain children in placements and give that continuity. It's always something that we're looking at, but we actually perform very well by comparison to other LAs.
We've got this program coming to Michael Sheen's program coming on this evening, and I think that I mean, he's looking at practice, and some of the practice I think might include things like, I mean, seeing some of the bits on the news today where one young woman was talking about the number of moves that she had. I think that's going to be related in that, and I think it is going to be an area of concern that all the authorities in Wales are going to be scrutinised on by the public, and it is an area that and we all know that the more moves a kid has, the less well their outcomes are likely to be. It's one of the facts of social work, I think. But I mean, it's good to see that we are good in comparison, but in comparison to what we should be. Where a minimal amount of moves should be the target. 3 in a year for 10% of the kids isn't. It doesn't feel right to me.
Yeah.
Thank you.
And I think what you're saying, Councillor, is needing to understand what that was about. So what's the context for those 10%, isn't it? So figures tell us something, don't they? But not everything. Thank you.
Absolutely, that's what I've been saying all evening. Yes.
Helen? You still got your hand up. Is that an old one, or would you like to come back in?
But yeah, I just wanted to follow on from Neil's point, really. Do we get those statistics? I think it's directed towards Rachel, really. Do we get those statistics on the moves? And would they be available to us? Because I'd be interested, because I'm the other end of it in my job, because we pick them up at Llamau the other end. So I'd be interested in, is that available to us?
I mean, it's a performance indicator, which is why it's featuring in the report. So across the 22 local authorities, everybody's asked to account in relation to that area of performance. I mean, I think you can ask for whatever you want reasonably, can't you? And if there's information that you require, I think what I'd say to you, Councillor Payne, is potentially to ask for that context as well, in the same way that Neil Thomas is advocating. Thank you.
Yeah, thanks.
Thank you. I don't think there are any more questions. Can't see any more hands up. Thank you very much, Lance. Keep on with the challenges. I'm sure you'll do as best you can. So does everybody agree with the 3 recommendations that we've considered the report, etc.? Thank you very much. Which moves us on. Yeah.
Chairman, sorry to interrupt. Just obviously, the committee are being asked to note a report. Obviously, you have mentioned some points that Lance has agreed to take forward. So, with the committee's permission, I would obviously have a recommendation to say that you have recommended those changes to Lance for editing the report, because obviously you have got the report today as formal consultation. So it'd be nice to reply with those points specified within your recommendations. Is that okay?
Yep, that's fine by me. Can I have a seconder, please?
I'll second.
Thank you, Neil.
Thank
Lance, did you want to come back in?
Only very briefly, and it's just to say I'm really grateful for the fact that you've all read it and the fact that you've taken the time to comment. I'm not being defensive. I really want to hear that feedback, and I particularly want to thank Councillor Lynch-Wilson, because those comments, when they come from people who are really in the business and really understanding it, mean a lot more than when they come from a senior manager like me. So thank you.
Thank you. Which takes us on to agenda item 8, which ties up the last municipal year. Lance, are you doing this one?
Yes, I believe so. Sorry, I've still got my director's report open, so I'm just going to have to move it.
It's the annual delivery plan.
Yeah, it's taking a while to open. I'm sorry. It's struggling a bit on the computer for some reason this evening. So in fact, I can't open it at all at the moment, which could be a bit difficult for me to do it.
Sorry, Chair, can I make a suggestion that somebody else screen shares it?
I mean, essentially, it is our annual performance monitoring report. I don't tend to go through them at length anyway, whilst hopefully my computer is rebooting, or this bit of it is. I would, rather than actually talk to any specific parts of it, would look for any questions, comments or queries that you may have that we can answer. It covers a huge amount of activity, includes performance measures as well as service plan actions and what we've achieved. Where we haven't achieved things, I think there's an explanation, but I'll be happy to elaborate as with my colleagues if there's any questions or queries on it.
Yeah, I'm sure we've all read the report because these reports have been extremely interesting this time. So does anybody have any questions having read the report for Lance? No, nobody. Well, thank you very much for the report, Lance, and the statistics are all there of what's going on, etc. So if nobody has any questions, then I have no urgent items, so I draw the meeting to a close. Have a lovely evening. Thank you all for your attendance and for your input. Thank you all very much.
Sorry, Chair, just before we go, can I have a mover and a seconder for that last report, please?
Oh, yeah.
I'm happy to move.
Thank you. Thank you.
Thank you.
Thank you all. Thanks very much. Good night.
Thank you very much.
Bye-bye.
Night. Good night all. Thanks to the officers.
Thank you. Have a good evening.